since I've been back. But it's it's the most common subspecialty of pediatrics in the United Kingdom. And community pediatrics, pointer. I forgot after. Okay, so as I mentioned, it's the most common subspecialty in the UK of pediatrics. It covers all these areas: developmental pediatrics, child protection and child abuse, medicals for looked after children, so children in foster care and going up for adoption. And then this whole big chunk of children with special educational needs. In England, by law, they have medicals done, so that's done through community pediatrics. Our health promotion is the other big area, and we know that almost 30% of children now are obese, and that leads to our diabetes and non-communicable diseases and mental health problems and all these things. So if we could stop childhood obesity, we might reduce a certain amount of mental health morbidity also. So that's the overview, and it focuses a lot on the multidisciplinary approach, because one practitioner cannot do everything. We focus on the quality of life of the child in the community, children with medical problems and other developmental problems. And it also incorporates advocacy, meaning if you see problems out there that there are no services, or what do you do in the context where you live? You have to try to find ways to improve things. I'll just briefly, you all know all these multidisciplinary services that support both mental health, child development, things like speech therapy, occupational therapy, physiotherapy, social workers, psychologists, good educational support, family support and parenting skills, and safeguarding. You know that speech therapy and occupational therapy are not available widely in the regional health authorities, very basic rehabilitative services. You might ask, well, how common are developmental problems in our context? We don't have local figures to tell us exactly. American figures suggest about 15% of the pediatric population. If Trinidad under 19 population is about 300,000, and you take that 15%, you're looking at about 50,000 children. So it's a very big morbidity. So we've just been speaking about the other 85%, who are already impacted by all these psychosocial factors that are affecting children's performance in schools and bullying and deviant behavior and all these things. But there's a big 15%, maybe 20% in Trinidad possibly, who already start off with a developmental problem, and then you're going to impact them with all these other factors. And again, what happens to children with developmental problems? They become adults, lots of them. Okay, so you're going to get... So are we optimizing their developmental potential? Are we trying to get them independent as an adult who can function in society and have a job, to make some money? Are they safe? And then they're all risk of adult mental health morbidity also. So with this big chunk of children, are our services, winning in terms of their long-term potential? So I started in 2010. I worked in the UK for 7 years. And when I started in 2010, I was getting about 50% of my caseload in our clinics was developmental. And it now is about almost 90% of the caseload. And about 30% of my workload right now is from autism, which now is a pretty significant condition worldwide. I saw about 1,000 cases over the last 5 years. That's new patients. 56% needing speech therapy, of course not available in Southwest. 29% needed occupational therapy, of course also not available. Oops, something. What did I do? Try and get the slide to change. I don't know. The light is coming on, but the slide is not changing. Huh? You can change it there. Change it on the computer? Or is it changed? So I just mentioned this. Well, rehab services are needed in all aspects of health, adult medicine and pediatric medicine. Next slide. You can change the slide there? I don't know why it's not working. Don't know? Okay. All right. So I already mentioned availability of services. Actually, Tobago, and congrats to Tobago, Tobago has speech therapy and occupational therapy in their public system, as opposed to other RHs in Trinidad and Tobago. So we need to learn something from them. And what families who cannot access services, or what happens to them? They might pay out of pocket. They apply for a special child grant, which is only at $11.50 a month. They might try to get aid from the Ministry of Health, or they mightn't just access any therapy at all. This is just some data on autism, looking at the life cost of autism in the US. It's about 1.4 to 2.4 million US dollars. Works about 10 to 15,000 TT per month. A child needing speech therapy, occupational therapy, behavior therapy, at the cost of those three privately, comes up between 5 and 10,000 a month if you're really going to pay for it properly and all that. It is quite expensive, and we don't have services in the public service. So quickly, what I'm going to speak about now is just a project we did in Southwest as well as nationally, looking at services for autism. I'm not going to go in detail about autism, but this is just autism. It's a problem affecting social interaction, communication, a whole range of behavioral issues that go along with the condition. Presents commonly in preschool children with speech delay, problems with socializing, obsessive interest, repetitive behavior, sensory issues. Okay. How common is it? The American figures suggest maybe as high as 1 in 68, generally worldwide about 1%, so 1 in 100. If you take 1 in 100 and 1.3 million in Trinidad, you know, you're speaking about large numbers. The United Nations has recognized the need for greater services for children with autism and developmental problems. Our Ministry of Health in 2014 actually went to Geneva World Health Assembly, and they made a position statement looking at autism and developmental problems. And this is information from the ministry. And you know, I won't go through all details of the statement, but if you look at it, it's quite idealistic in terms of what we want to achieve. I mean, we need to have ideals, but the question is, how do we actualize the services that we need? So it recognizes as a major public health concern. Okay. Mental health problems and child developmental problems are non-communicable diseases. So in our national plan for non-communicable diseases, where we focus on diabetes and hypertension and heart disease, we need to also incorporate mental health and developmental problems in Trinidad. And you know, we need all the multidisciplinary support services, etc., etc., etc. So let's take, so just autism as an example. If you look at it nationally, what you need is a national policy, a national action plan. You need services for screening and diagnosis, rehabilitative services, autism-specific therapies. You might even be able to harness your tertiary institutions to do more training in specific therapies, a parent training program, training of educators in schools, support in the educational setting, social support services, child protection services. All of these tie in to a national perspective for autism. And because we lack in many of these areas, you need advocacy to be able to try to improve things. So what did we do? Well, I've been trying for speech and occupational therapy ad nauseum in Southwest for the past 6 years. We sort of made some success, but it's still far below what we would like. I presented this in TTMA conference in July, a little project that we did with a few partners. I was approached by an NGO, Rotary Club, and they said, I want to do a project on autism. Okay, so I said, okay, fine. Well, I want to do some training on a tool called ADOS, Autism Diagnostic Observation Schedules, a nice tool to help you with the diagnostics of autism. So the guy was an engineer, and he thought, well, that sounds like a good project. So then I found out, well, they have money. Because we've been trying through the public service to see what we could do, but they had money, so they were willing to pay. So this is just ADOS is a very good tool for diagnosis. I won't go too much into the diagnosis just for time. So what happened is that Rotary Club Bahadursingh West, Community Pediatrics in Southwest, the Training Department of Southwest, UWI Pediatrics, North Central Pediatrics, and Vanderbilt University in Tennessee, they have a treatment and research institute for autism. And we negotiated with Professor Warren from that university, and he came down to do training with us. And we hosted it in San Fernando Teaching Hospital. We got funding from Rotary Club. We managed a project by Rotary Club and our training department in Southwest. We got psychiatrists, psychologists, pediatricians, GPs, therapists that attend training from all the RHAs of Trinidad and Tobago, and we had 2 participants from the Bahamas also. And we did one test, it's called screening test for autism in toddlers. We did that one on the Friday, and we had participation from all the RHAs. And then the ADOS training, which is a more specialized, sort of heavy-duty tool. We got child guidance clinic in North, child guidance clinic in South, and the 2 pediatric services in North and South to participate. And then since training has been done, this was done in April 2015. Yeah, April 2015. So a year later, we've had uptake of the use of the screening tests in not all the services, but about 3 out of 5 of the regions. And the ADOS has been utilized in all the areas that have been trained. We have had utilization of the tool. So we've had success. And then after the ADOS training and STAT training was done, as the tools for diagnostics were completed, we had a follow-on project, which was this project, Caregiver Outreach Program of Education, or we decided to focus on helping parents to manage their children because of the gross lack of services. So in the Vanderbilt University, they have a nice parent training module program, evidence-based, that they do with their parents. So we said, well, why not we get them down? Rotary said, yes, we'll pay for it. And we will train trainers to teach parents on how to manage their kids and try to help the parents. So the first phase of that program actually happened in, again, we got all the RHAs involved, and we, the Rotary Club funded it. Same committee worked on it, and we did 3 modules: communication, behavior, and toilet training, very important for kids with autism. And the first phase of the training was completed in March of this year, and the second one is happening in December, and we have a third one carded for next year. That's the parent training program. We had good feedback from parents. In Southwest, our team worked very closely with the Child Guidance Clinic. We have an excellent working relationship in Southwest between Child Guidance Clinic and Community Pediatrics. We work really well together. And we jointly carried out the parent modules in Southwest. The first 3 that were done, we jointly offered it to our parents in the public service, and we hope to regularize it next year also. Other areas that needed for training. So educators, if you could have a similar sort of a project with student support services and training teachers in schools and how to manage autism in schools, because a huge problem is how do you manage these children in school. So that would be a wonderful project to do. Another wonderful project would be autism-specific therapies. Example, ABA, which is Applied Behavior Analysis, is a pretty good approach that is used in the US a lot, good evidence. There are other methods also, but for example, if we have a psychology master's program in the university, producing psychologists every year, all you need to do is contact someone from another university who can run a program, get them down, train a psychologist to do ABA, and then you could have greater services. We invest so much in tertiary education, so I'd love to see that program happen in the university. And you have university people here, so please listen. We want that program to be done through the university. Student support services, work in progress. You know, health services need to collaborate well with them for the long-term benefit of the kids that we see. Child protection, Children Authority is there, but if just reading the newspaper and the volume of cases that are being highlighted, there needs to be great partnership between health services, National Family Services, all the services need to be involved. And we need greater clarity and protocols and how the systems work with each other, because we do have resources in Trinidad. And by the way, Trinidad is classified as a high-income country. I don't know if you all know that, right? But that means Trinidad has resources. It's how well we work together to create better services. Transitional medicine and transitional clinics are very important to move over kids from children services into adult services, extremely important. And we don't have many adolescent specialists in the country. In fact, we have one in the university, but we don't have adolescent services as a specialty developed in Trinidad. That's extremely important, has to work very closely with child and adolescent mental health services, but adolescent medicine is extremely important. And just take home point, well, so just by the way, an NGO came to me and said, I want to do something, right? But it did work because we got funding. And you know, just like in Tobago, they had their program and they didn't have funding, and they've managed to find a way for funding. I'm saying that if we see a need and we have a perspective to develop services, let's try outside the box and see what we could do. Right now with the oil price low, you mightn't get any money truly. If I go ask my CEO, he said about no money. So let's look outside the box and see what legitimate ways we can improve things. All right, so I think that sort of concludes my presentation.